Okay, I'll call the meeting to order. And the first, Terry asked if we could amend the agenda to move number 9, Amber Erickson, up to I guess number 5 on
If
the
we could do
agenda.
roll call,
Yeah, we'll do a roll call. Yeah, sorry about that.
Lisa, do you have all the members? You can do the roll call?
I sure do. Yeah. Okay, Clarence Campbell,
Here.
George Busse,
Here.
Matt McKenzie,
Here.
Dr. Keller, Dr. Keller, Dr. Horny, Dr. Horny, Laura Cruz,
Here.
Joy Hendrickson,
Here.
Laura Negro,
here,
Richard Huber.
Here.
Okay,
Dr. Keller is here on the phone, a little late, sorry.
thank you, Dr. Keller.
Thank you.
Okay,
Okay, now if we could have a motion to move number 9 to number 5 on the agenda. And then
This is-
approve the
this
agenda
Rich-
as amended.
Okay, this is Rich Huber. I'll approve the agenda as is amended.
This is Laura Cruz, I second.
A motion made and seconded. I guess to move number 9 to number 5 and approve the agenda. All in favor?
aye,
Aye.
Aye.
Opposed, motion carried. Okay. Next item is the approval of the minutes of the last meeting.
I would move for approval.
this is Laura Negro, I'll second that.
Any comments? Otherwise, all in favor? Signify by
Aye.
saying aye.
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 Opposed? Motion carries. Public comments, anyone from the public on either online or on the phone wishing to make any comments? Seeing none. Seeing none, we'll move on to Ignite grant update. Scott.
Hello, everyone. Can you hear me all right?
Yep.
Great. So for those of you that haven't heard yet, we partnered with the school district of Ashland to apply for an ESSER 3 out of school time grant. It was a grant we could have applied for by ourselves if we had chosen to, but by partnering with the school district, the school district is actually the official applicant. I wrote the grant and then worked with Rob Prater and Melissa Gessert from the district to submit the grant on behalf of the district. And we did receive a $575,000 grant to provide some additional supports for some of the most marginalized students in the school district. So if I have just a quick opportunity to share my screen, I have, let's see. Oh, you know what? It's not that big of a deal. I had a little diagram, but it doesn't look like it wants to come up. So we'll just hold off on that for the moment. And but we are identifying students based on students who have been suspended, students who are failing classes, students who have who are a low socioeconomic status, that have low attendance rates. And so we're identifying a Venn diagram of those students, and we will be offering some additional supportive programming, possibly in the later afternoon of the school day, and then later into the evening after regular Spark programming. And there hasn't been an enormous amount done on the grant yet. We just got word that we received it in December. We just got the go ahead from the state in January. And the first step has been to, the district needs to hire a 0.2 position, a 0.2 time position to be the district liaison. They need someone at the district to actually manage the grant fund from the district end. And so that position's been posted. We have at least one applicant, maybe multiple applicants, and we are intending to interview for that position sometime, hopefully in the next couple of weeks, so that we can get that position hired. At that point, then for the most part, the funding will be funneled through to the county, and then Spark will be hiring a couple additional staff members to kind of provide academic, social, emotional, and therapeutic support. So we will also be looking to actually hire a full-time behavioral health provider, because we can actually provide behavioral health services with the grant funding. That's one of the first grants I've ever seen where we can actually provide direct services with the grant funding without having to jump through the hoops of insurance or anything along those lines. A lot of the kids will qualify for Forward Health or something along those lines. And so if they do, we're hopefully going to be able to partner with the district to actually bill insurance if it's easy and it's accessible, because that will just help the grant money stretch a little bit further. But we're excited about being able to offer this additional support for some of these kids that are really at the margins within the school district right now.
So
Any
we're
questions for Scott?
very, very excited about the grant, and yeah, any questions you may have?
This is Rich Huber. I have one. How
Sure.
many schools does this involve? Does it involve all the schools in Ashland County?
So right now we partnered with the Ashland School District to write the grant. So the school district of Ashland is the actual recipient. And so one of the things that was kind of innovative about the way that we proposed this, I think a lot of a lot of the folks that were looking at this kind of grant money would be looking at providing kind of a broad set of universal supports. And part of what we suggested when we wrote this grant was that we were going to focus this on a relatively small number of students that kind of fall within that Venn diagram of all those things that I mentioned: low socioeconomic status, et cetera. The short answer to your question is that we partnered with the school district of Ashland. So specifically, we're looking at students within the school district of Ashland to do this. And part of that, a lot of that is logistics. A lot of it's going to happen on site at the Spark facility. And so it's a lot more difficult to provide that type of service down in the southern parts of the county.
Yeah, I mean, I don't think it's too fair to get a grant from Ashland County and you don't involve all the schools, but I guess whatever.
Well, the grant is from the school district of Ashland was the grant writer and recipient.
Well, I'm sure you could have asked a different school to do it also, but.
Yeah, and I think it brings up a really great point that obviously the programming that we've been doing thus far with Spark has not really reached down into the southern part of the county, and I think it's an area where there's obviously room for improvement and growth, and I don't see the short-term solution to that with the current programming model, but because we are location-based with what we're doing, we had started to approach Mellon at one point before the pandemic, and finding a location to run that program down there. We had secured a location, and then once the pandemic came, all those plans were halted, and we have not picked that back up again since then.
Oh, yeah, okay. Yeah, I just think it's kind of a sad situation. That's a county grant, but it only applies to one city. Doesn't seem fair, but
Yeah, I think that's a legitimate concern, and I do understand that, and I think that's a bigger question that we should consider, and it may be worth trying to put together another round of grant funding somewhere to look at some more specific design for the southern part of the county.
One thing to mention, however, is this is funded by ARPA, the American Rescue Plan, and it is very time limited. So all of the funds, all of the programming is done the end of December 2024.
Yeah, this particular round of grant funding is very time specific and very short.
so
This is,
what are you saying then? Rest of the schools, you don't have time to talk to the rest of the schools or what?
Well, the grant came up into my awareness about 2 weeks before it was due, so there was not a lot of time to reach out to much of anyone to get the original this particular application in and written. So this ARPA funding is all part of the I guess I don't know even specifically what the ARPA acronym is specifically, but this is one opportunity that came across my desk, and I decided to write that grant in partnership with the School District of Ashland, and that's where we stand with it right now.
Oh, okay. I think in the future, maybe we should work on this so it's fair to everybody in Ashland County, not just the city of Ashland. So thanks.
Yeah, thanks for the comment. I appreciate that.
Did somebody else have another question?
Matt has his hand up.
yeah, this is Matt McKenzie. Are these going to be school board or Ashland school employees that you're hiring, and are they full-time, part-time, and are they going away then on December 24? What's the plan there?
Yeah, so what we've written at this point is that this will all be coming back to you once the district liaison is hired. That's been part of the challenge, is kind of waiting for the district position to get hired first. But the draft plan at this point is that the county would actually hire these positions, but on a short-term basis. We are looking at trying to create a couple full-time positions because we're looking for a teacher, we're looking for a therapist, but we are hoping that we would be able to hire those under the county umbrella for the short term, and then bill the district for the actual funding. But they would be really written specifically that these positions would end at the end of the funding period.
Has the executive committee been made aware of this and approved this?
No, none of these positions have been approved. We haven't even made a pitch specifically to anyone. Again, the district is the recipient of the grant, and then once they hire their district liaison, then we're hoping that we can put together the rest of that plan as to the specifics of hiring and writing job descriptions and approving job descriptions, et cetera.
Is there any grant match requirement for Ashland County?
No.
Okay.
Laura Negro?
So this grant does cover the position's pay.
Yes.
Okay, thank you.
Pay, insurance, all it would cover all of the expenses associated with the grant, or associated with delivering this part of the program.
Any other questions for Scott? All right, thanks, Scott.
All right, thanks everyone.
Now next is Amber with the 2022 year-to-date expenditures.
Right, good afternoon. I will try to share the, what was included in the packet here. See if it'll let me. All right, is everybody able to see my year-to-date expenditures?
No.
Not yet.
No.
There you
Yes.
go.
Okay. Now you can see it?
Yep.
Yes.
Okay. Okay, so, as you can see, just looking at the departments, overall, looking at the levy, some are a little high, some a little bit low. This is reflecting everything that has been received and paid through December. So we are still working on our period 13 expenditures and revenue, so this will change until we get that in. But it gives us a little bit picture of how we're looking. As you can see, overall with our levy, we got about 124,000 left in there. We do know there was about 130,000 paid out for December, but paid out in here in period 13 for some children in sub care. So that will be coming right off our levy. So I do know we will be going over our levy. The exact amount, I'm not sure yet until we can get everything entered, but I am predicting that we will. And when we get to the next meeting here in April, then we will have everything entered and have a really good picture of how our year end of 2022 looks. Does anybody have any questions for me based on this report?
I don't see anyone have any questions?
This is Laura Negro. Amber, is there any particular section in here that you feel you need to highlight besides just the levy piece?
I mean, like looking down here, like for as you can see here, this will be looking at our children's here. This is where we know that another 130,000 is going to be coming out. They're the ones that have the most that are going over. So I probably would want to highlight this, knowing that those expenses are still coming in, but then there's some that are coming in under, but, and then that's when and when we get, there's still some, you know, insurance payments that are coming back and some grants revenue. So looking at the overall picture, I don't know exactly what it's going to look like, but I do know that we have those expenses coming out that are coming right out of our.
I do have a question too on the community service programs. There's only 26% of the levy that was used. Is there a particular reason for that one so low?
You know,
I can speak to that, Amber.
Okay, thank you.
For that one, which is good for us because this is supposed to be 100% funded program, we are finally catching up and getting more of what has been promised to us. We have to be somewhat of a bulldog and not let go of them not paying their full share. So we are doing much better in that area and we'll continue to work on that.
Okay, thank you guys.
Mm-hmm. Laura, did you have a question?
Rather a comment. When I look at the breakdown, I'm always just really impressed by the amount of money that comes into the county through grant funding. And I really think that should be highlighted to the community. Without that level of support, the county would be in really dire shape. So I commend the staff for the hard work and bringing those funds together and the initiative to really find different sources of money so we can promote access to services to so many of our people in the county.
Absolutely.
Anything else for Amber? We'll move on to the next item is the Sharps collection policy. Liz.
All right, so the first item I have here, as Clarence said, is our Sharps collection policy, and I believe the revised version of it or edited version was included in the packet for everybody to review. So our existing Sharps policy and collection and disposal was last reviewed or approved in 2014. We haven't had any revisions or adjustments made to it since that time. So what we are proposing for changes or updates to the policy would be to remove the phrasing of persons dropping sharps for disposal must be an Ashland County resident. We would like to remove this portion of it just because we do have, we're so close with Bayfield County. We have so many people back and forth readily that we don't want to specifically have it be a Ashland County only, as we have so many different residents from other counties coming into our community. And then the other part of it is to update the cost of each drop. Currently, we are at $5 per container. So we would like to update that to $5 per pound or a $5 minimum. Sharps containers vary in size across the board. You can have the itty bitty less than a gallon containers, or you can have an instance where we currently have a 18-gallon container sitting in our storage waiting to be picked up. And that is, for reference, about this tall and about that wide. So when you're paying $5 per container, that person's getting off at a bargain there. So we do contract with Stericycle to come in and, dispose of our sharps for us. So it's a annual contract. The annual contract of that comes out to be, it's roughly $125 per month or $1,510 per year. When this policy was initially written back in 2014, the actual cost per year was roughly around $800. So the cost of disposal has gone up significantly, and the number of sharps that we are taking in, it varies. Obviously during flu season, we're disposing of our own sharps as well as, year-round vaccinations. But, like I said, when we have people bringing in 18-gallon containers full of sharps, it really kind of adds up quickly, and then we can end up with additional charges to kind of offset that. So what we're looking for, like I said, is to update it to the $5 per pound or a $5 minimum rather than per container. In 2022, we had received sharps drop-offs on 37 separate occasions. Most people, when they drop their containers, they do have kind of the standard size, which is roughly around 2 gallons. And that 2-gallon container, if it is filled appropriately, weighs roughly 2 to 3 pounds, depending on how it is overfilled, because some people like to overfill them. So again, that is, a risk for us and the company picking it up. If it is overfilled, there are the potential for additional charges. And just kind of a comparison, when we compared in the northern region, we are one of the only agencies that actually still charges per container rather than per pound. Pretty much everybody has switched over to a per pound charge for it. And at $5 per pound, we would still be one of the least expensive. As an example, Florence County actually charges $9 per pound. So are there any questions on that, or?
Liz, this is Joy. Do you only accept the Sharps drop off from individuals or businesses as well?
We have had a couple businesses utilize as well, and they pay the same fee. It's very infrequent. I think over the past year, I'm thinking of 3 occurrences where we've had businesses bring in Sharps.
Okay. And then my follow-up question is, when your policy is finalized, may I share that with my staff? We are updating our Sharps policy and we actually reference other places that patients or employees could drop off their Sharps.
Most definitely, yep.
Thank you.
Liz,
Need
this is
a
Matt
To
McKenzie.
approve the update.
I've got a question, Clarence. If
Okay, go ahead.
it's my understanding that Sharps could now be disposed of by simply putting them like in a Gatorade bottle and then throwing them in an appropriate dump, and then it can go to the landfill. So I guess I'm somewhat surprised that we're still collecting them and charging them. If they can simply dispose of them by putting them into a Gatorade bottle.
I would hope
or-
that nobody's putting them in a Gatorade bottle and throwing them in the landfill.
Well, it's legal for them to do it. They can put it in a Tide, one of these detergent bottles. So I guess I'm a little surprised we're still doing it. I don't have a problem with the $5 charge. I would even make a motion, we amend it to a $10 charge. But I think it should be made great awareness that they can dispose of them in other ways, that you're not having to deal with the problem.
I am not aware that Sharps would be okay to send to dispose of in that manner. Especially in something like a Gatorade bottle that would be easily openable. You have the risk for environmental contaminant, obviously injury to someone from the Sharps or potential bloodborne pathogen exposure. So that would not be a recommended means of proper disposal for Sharps.
This is
Okay.
Joy again. I just Googled the regulations around some of this actually comes from the DNR. And right on their first page, it says it's illegal to put needles and other sharp medical items in trash, recycling, or medication collection drop boxes. So it is preferred to use preferably a DNR list of or DNR registered sharp collection stations such as Ashland County Public Health or other DNR registered sharps collections or other sharps collection stations that aren't even DNR registered, but it is definitely not the preferred way to put sharps in a Gatorade bottle and put it in the trash if you have another option.
This is Laura Cruz. Knowing individuals who have used Sharps, not condoning this, but putting in a Gatorade bottle is better than just throwing them in the trash. And again, I'm not condoning it. However, when you're talking about addiction, it's really challenging. And so I don't know if there's an opportunity for us to, and I'm sure that this would create an outcry, but having Sharps containers more available in public places so individuals could drop those off and not be concerned that they would be followed or maybe charges against them because they had illegal substances within them.
There are several publicly accessible, like open to the public accessible Sharp containers, specifically within the city of Ashland. One of them being kind of on the back side of the Vaughn Library. There's one down by, I can't remember which beach it is, down at the end of the tunnel, I believe it is, at that beach. And then I think The other one is up by the breading center. I may be incorrect on that, but I think that's where it is. But I know there's at least 3 of them within and around the city of Ashland. The Schwamgen Coalition on Emerging Drugs has helped to facilitate the funding for providing those sharps containers. And initially when that happened, they did provide funding for a substantial amount of sharps containers, was my understanding. And I believe the city still has quite a few of those left. So it is something that is out there. I don't know how well known it is, but I know it is something that is out there. And then I know Bad River also has the needle exchange program, and Philomena readily works with people in any way, shape, or form to facilitate that as much as possible.
Laura?
This is George Bousset. Hello? Yeah, I mean, regardless of
Laura
the
had her hand up
conversation,
first.
asking to be recognized, Clarence.
Laura had her hand up for a while, so let her go first and then George.
I got 2 things. One, hearing about people not knowing where these containers are, maybe we need to do a little bit of a public awareness campaign with it also. And then if we are going to approve this, I know it looks like the 2014 passage there. Do you want the effective date changed on that? Because I know it's in there, it says 2019 on there, but you know, your name has changed and some of the stuff inside. So if we're approving this as the we're looking at, do you want that changed also to effective 2/15/2023?
Yes, and I'm wondering if maybe not all of the edits showed up on the version that you got, if that wasn't changed.
The stuff you mentioned as I went along with it seems to be changed on this online one. It was just that date isn't changed up there, so.
Okay, all right, I will make sure and update that pending motion and approval.
Okay, because I was gonna make the
George?
motion, but
George, do you have something?
No, I think Laura covered my concern. Thank you.
All right. Okay, if someone would like to make a motion, we can proceed.
this is Laura,
Laura?
I'll make the motion that we make these changes in the policy for the sharps collection and disposal stations, along with the effective date on that to be 2/15/2023.
Laura Cruz, so second.
Okay, motion and second. Any further discussion? Otherwise, all those in favor of approving the sharps collection policy updates signify by saying aye.
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 Opposed? Motion carries. Next item is public health updates.
Right, and now we're going to see how well technology agrees with me today. So fingers crossed this works, because I historically have issues with presenting these goofy things. Is the screen showing up so you can all see the
Yes.
screen?
Yes.
Yes.
Okay, so this update is specifically to our overdose fatality review team. So just some background information. The OFR was initially established in fall of 2021. We began adding members to our interdisciplinary team in the spring of 2022, with our first official case review being completed in June of 2022. Since that time, we have met regularly. We try to maintain a monthly schedule with one overdose fatality review case being completed each month. The overall goal of our team is to review the circumstances of each case. We review this from a multidisciplinary perspective, and the goal is to determine what gaps can be identified. These reviews are not meant to place blame on any one single organization. facility or an individual, but rather to determine what interventions could be put into place in an effort to prevent any future overdoses of a similar nature from happening in our communities and to identify any potential trends that we might be noticing within our communities. So in this slide presentation, I have just kind of some general data information that we've collected since the reviews have been started, some trends that we've been noted. So this slide just represents the number of cases that we've had over the last several years, beginning in 2019. The data sources that this information was pulled from include WISH, which is the Wisconsin Interactive Statistics on Health, and also Vital Records. Of note on this particular slide, the data collection for 2022 remains incomplete as there are a number of case investigations that are still pending. Autopsy and toxicology reports can actually take upwards of 6 months, if not longer, for the final information to be reported back to us. And in that case, the investigation remains open and the case is not officially considered an overdose until we have all of the facts in. So currently for 2022, there have been 6 confirmed fatal overdoses. And there is the tentative potential for upwards of at least 6 additional more cases to be added to that total. So that would then bring our total for 2022 to 12 cases, which would be the highest we've had in the past several years. Right now, 2021 is coming in at the highest. And going into the data, it kind of gets you into a rabbit hole. You can look at the data in many different ways, many different perspectives. So this slide is just a overdoses by gender. The line going through the middle represents the average age of individuals combined for those respective years. The data sources identify individuals as male or female. Data is not de-identified as far as those who may identify differently. So it's just strictly male, female from the data sources that we were able to obtain. We also looked at overdose deaths by individuals broken down by race. For Ashland County, our populations are predominantly white or American Indian. So we did break that down just for the number, which you can see there's a bit of a disparity. I know for the pending cases for 2022, with the information that we suspect, but we cannot confirm, there would be a significant disparity for the number of American Indians who suffered a fatal overdose as compared to their white counterparts. And like I said, you can really go into the rabbit hole as far as data goes. So we actually broke it down by overdose deaths related to education level. The majority of individuals did have at least a high school diploma or a GED equivalent. We do have some individuals who, have associate's degree, at least some college education, bachelor's degrees. There's a multitude. I mean, this substance use disorder spans a vast variety of people. It is not specific to one individual group of people. And I think looking at it just from the different data perspectives, especially as education level, definitely kind of can give you that perspective, just by the number of people that are affected. And then also another perspective that we have is the substances that were actually in the toxicology reports. So, and this graph is kind of goofy to look at, but kind of overall for the largest spikes are the substances that were most commonly associated with a fatal overdose. So these substances that we have here, this is cumulative data collected since 2020. So in Ashland County, the most common substances that were associated with a fatal overdose were fentanyl, methamphetamine, and hydrocodone. Gabapentin also coming in at a very close, it's kind of mixed into the spike with the hydrocodone there. So those are the most common substances that individuals have utilized that did result in a fatal overdose. And just some of the other substances to pull out or to kind of identify, one of the, I guess, scarier substances as well is the one down on the very far end, the xylazine. Thankfully, we've only actually seen this substance show up on a couple of toxicology reports so far, but I know it has been significantly problematic in larger metropolitan areas. It is actually a veterinary sedative that is used most commonly when sedating cats or dogs in I guess, minor procedures, veterinary procedures. There is very little study information that has been completed on the effects of xylazine when used in people, other than we know that it suppresses the respiratory rate. And we don't know specifically what quantity it takes to completely suppress a person's respiratory rate. But what we do know is that there is not exactly a reversal agent for it. So it is one of the scarier ones that we are hoping that that trend will not reach to us, because it's been very problematic in, like I said, more metropolitan areas. So one of the trends that we've been seeing of the cases that we've reviewed to date is that there is a gap in follow-up services, specifically the availability of transitional housing. And for our area, the gap in transitional housing is specifically affecting female community members to a greater extent than their male counterparts, as there are more options for male accommodating facilities within our region and throughout the state as compared to their female counterparts. So for many of our community members who are seeking treatment for their substance use disorder, if there is not a transitional housing option available for them, they're then, if there are no other options, they have the potential of then just being returned directly to their community and to the environment which contributed to their substance use disorder. So what we have, what our recommendation would be from the overdose fatality review team, based on the trend that we have been seeing, would be to consider utilizing the monies from the opioid settlement funds for the formation of a local transitional housing unit, whether that be a small unit accommodating a small number of people, or, you know, as time would go on, if we would be able to accommodate more individuals in that. But that would be our overall recommendation regarding transitional housing. And to explain the duck on the picture, one of the best analogies that I have heard about this situation that we are facing is that of raising ducks. So you get your ducks. You've picked your ducks up from a not so great environment. We'll call that a dirty pond. You've cared for your ducks and you've cleaned them up. So, sorry. But you have your bright, fuzzy little ducks, and your ducks are doing great. They're in treatment. They're showing so much promise. And without a place for your ducks to go to practice the skills that they have learned and to preen their feathers, however you want to say it, you're going to throw your ducks right back into a dirty pond, and you end up with the same situation all over again. So, does anybody have any questions?
Laura?
I'm just wondering if we can include this in our packet, so that way the date is in there too.
Yeah, I can get that sent out to everybody.
Yeah.
Thank you. And thank you for being the kind and caring person I know you are. It's hard doing this stuff and we're right there with you.
Yeah, I wasn't expecting that reaction. I'm sorry about that.
You don't have to be sorry. That's
No,
what makes you great.
Dan?
Yeah, I just wanted to let everybody know that any day now we'll be getting some resolutions and legal paperwork for another opiate settlement. This one involves Teva, Allergan, CVS, Walgreens, and Walmart. Total settlement is over $20 billion. So the money will be dispersed in the same percentages as the last settlements. So as soon as we get that, that'll go to the executive committee and then the county board. And that has to be done by middle of April 18th, actually.
Any other questions for Liz on this item? And we'll continue on with Liz. Environmental health impacts.
Just going to monopolize all of your time today.
Yeah.
On to a much drier subject with this one. With the previous meeting, there was a request for information or consideration to environmental health impacts associated with our programs. So public health and many of our organizations, we've worked in partnership with the Ashland County Extension Office over the past. Last year specifically, we were working on some projects related to climate impacts. We had worked in partnership with DHS, and actually I had the pleasure of giving a presentation on extreme heat, which unfortunately there is a recording of floating around out there somewhere. So if anybody would like to go back and watch that. We've also worked in partnership on various different TIC programs and education to that extent. So we are planning to continue and to build on this partnership. Lisa Radke from the Extension Office had reached out on a project that she is working on, which she would like to call the Ashland County Climate Readiness Action Plan. So it is a work group that she is putting together, planning on launching this coming spring. So the purpose of the group would be to identify impacts that we've seen on various factors throughout the county, whether that be on human, people, or social circumstances, economic impacts, infrastructure, and then the natural environment as well. So Extension will be following up with additional partners, reaching out to healthcare providers or other various organizations throughout the county to identify potential health impacts and what we could do to minimize those impacts. So just an update that is in the works and that there will be more to come on that.
Any questions on that? Then we'll move on to the communicable disease ordinance.
The last thing I have, I promise. So the draft of the ordinance would have been included in the packet. The overall goal of the communicable disease ordinance would be to strengthen our local public health infrastructure. So as a local health department, we have a duty to prevent and control communicable disease within our jurisdictions. This is working in partnership with healthcare, different employment agencies, employers, businesses, schools, government, and elected officials to provide information and guidance. As a local health officer, we rely on data to make objective and evidence-based decisions, working to prevent and control communicable disease. And these decisions are not politically based. The type of control measures that are recommended or advised is dependent on the type of communicable disease and the circumstance surrounding the source of exposure. There are a variety of different policies and procedures that are followed depending on the communicable disease that is identified. In the process of this, the goal is to inform and empower, whether it be the individual, the organization, or the general public, to the benefits of observing recommended control measures. The overall goal would be to seek cooperation to carry out the least restrictive measures, issuing an actual order only as the last resort. Local health officers do have the legal means to issue orders and to address situations involving the presence of communicable disease involving a specific person, group, or business. This is outlined in Wisconsin Administrative Code 145.06. The Wisconsin statute and administrative code is least defined regarding a health officer's orders when applied to the impact of the general public or large groups of people. The Wisconsin County Association did address the implications of issuing and enforcing orders this was in light of the Supreme Court's decision in Legislator v. Palm. And there are several guidance documents that are very lengthy in and of themselves, kind of outlining all of this and describing the nature of everything that was associated with the Legislature v. Palm. The Supreme Court, the state Supreme Court, then on July 8th of 22, in the decision of Becker v. Dane County, held the Wisconsin Statute 252.03 grants that local health officers have the authority to issue general orders and to enforce those orders under an enforcement ordinance. So boiling down to the local level is kind of where it needs to be as far as any enforcement. And this ordinance essentially would simply be that would give us the local enforcement if we were to ever need such a thing. Ideally, I would hope not. But at the same time, kind of thinking back in my time in the health department, in the fall of 2019, I can remember providing updates to the board regarding measles outbreaks on both the East Coast and the West Coast, and what our local immunization rates were by comparison, and comparing to what would be considered a community immunity rate, which is generally recommended to be around 88%. Ashland County so far for, measles, mumps, rubella vaccination, our children that are up to date on the MMR series by 24 months of age in Ashland County is only 77%, which falls below what this rate would be, which could put us at the risk if measles were to rear its ugly head. We would be looking at a predicament. Polio is another one that has resurfaced. Mostly associated with isolated pockets of communities that have declining immunization rates. By comparison, children in Ashland County who are current with their polio vaccination series by 24 months of age are currently at 79%, which again is what would be below considered the community immunity. Tuberculosis is another disease that is often considered in these sorts of situations. Tuberculosis does continue throughout the state of Wisconsin. Wisconsin has averaged 54 cases of TB per year over the last 10 years. Ashland County has thankfully not had any confirmed cases of tuberculosis over the past 5 years. However, we have conducted several disease investigations to rule out an active infection. We have additionally provided guidance in treatment or direct observation therapy treatment to 9 individuals over the past 5 years for treatment of a latent tuberculosis infection. LTBI is not an active tuberculosis infection, but given the right circumstances for the individual, could become an active infection, which is why there is such a strong recommendation for these individuals to receive treatment. And then just as another example, prior to working in public health, when I was working in the acute care setting, I actually did provide care to a patient with active TB. So knowing all of this, when comparing the TB rate for our northern region is 1 per 100,000 people. I don't think I know 100,000 people. So just knowing the incidence and the potential risk for what we've had based on what the rate is, it is still a very real concern that we could have some sort of communicable disease like this show up in our area. And there's always Ebola as an example of something. Joy shaking her head. Nobody wants to go there. So what the proposal would be for our board to recommend and approve this communicable disease ordinance for review by the full county board.
Laura?
You mentioned WCA. Has this been looked at by WCA or A&D or corporate counsel to make sure that we're all good in all the right spots?
Corp Counsel has taken a look at it. He may tweak a couple of things on it. I don't have the tweaked version back yet. He was going to try to get it to me by today, but was not able to get it to me. So pending approval, when it goes to the full county board, there might be a slight bit of editing. The area that would potentially have editing would probably be under the enforcement section. He was just going to take a look at the county general ordinance as far as issuing a citation versus how the enforcement is currently written.
Okay.
George?
Right, I discussed this with Liz this past week, and my primary concern here are the due process rights of the parties against whom an enforcement is brought. And this is an intelligent proposal, so I'm all in favor of what this seeks to achieve. And I'm encouraged by the first couple of sections, which call for referring to the State Department of Health and review and reporting to State Department of Health. But that's a process of our staff. I'm encouraged by the fact that there's a warrant required for entering a premises. But other than that, a party that wishes to contest an order by this, as it's written, it seems to me is to the county board, this Board of Health within 30 days. So it strikes me it might be more acceptable, even though I think this is important, if there were some avenue of more immediate appeal for a party that would contest an order brought against them, just as a matter of due process. And I'm not sure that this body could meet and come to a decision in a sufficient period of time. It's a conundrum because you have to control the disease immediately, yet this person might have to wait 30 days to raise their objection to an order. I'm not sure how to solve that problem, but I thought it was one of the difficulties that we have to contend with.
Any thoughts?
I don't know that I have a good answer for that right off the bat without, I would have to talk to Corp Counsel and see if they would have any recommendations as to how that could be revised. In other ordinances that I have referenced and, reviewed in the process of writing this and kind of comparison, from different counties and things like that, they all seem to be very similarly aligned as far as what the process would be if an individual would want to contest that. specifically, two of the orders that I had referenced were Winnebago County and St. Croix County. And they were both very similarly written as far as that process. So I would have to talk with Corp Counsel to see about anything further.
Laura?
As for thoughts, it just says that the person that wants to appeal it has to do it within 30 days. It doesn't mean they have to wait the 30 days. So I'm not certain where, I mean, George, do you have some kind of situation you could throw out to show how this might hamper somebody? Otherwise, this part is on them. It looks like within the 30 days of this issuance to appeal.
Go ahead, George.
Okay, I'm only saying that the appeal is to this body. So it depends on the availability of this body to come together to make a decision on an appeal. And that might not be instantly, immediately available within days. I'm just a little bit uncertain. I was hoping that it might be a mechanism that if there was an appeal, if a party contested this, that Liz could refer, or the health officer could raise that issue to the state level and either be affirmed as the county health officer, immediately affirmed, and then go back to the contesting party and say, well, this is what we believe is necessary. It's been affirmed at the state level. If you still want to appeal, you can bring it to the county Health and Human Services Board, but there will be an immediate backup or affirmation of our local health officers' conclusion. That's what I was hoping for.
I guess as far as orders that would be written, if something would need to be done at any point in time, the orders would be, specific to whatever communicable disease was in question, as far as, if an individual needed, isolation and quarantine, or, whatever it would happen to be. I'll just use tuberculosis as an example. If the individual is actively infectious, they have to isolate within their home for, said number of days based on where they are in their treatment, in their infectious process, things like that. That specific order would then be to that individual based on their disease process and, X number of days based on that specific situation, which would be coming from recommendations from, their physician, infection prevention, BCD. So there would be a number of different components in this. It wouldn't just be me saying, sit down for 30 days. There would be a lot of different moving parts to this based on what the situation would be.
Go ahead, George.
So, I don't imagine this would have to be brought back to the state level in 1 out of 50 cases. So, the local health officer would issue the order. Most people are just going to comply. But if someone is hard-headed and annoyed and upset, and they want to contest this and they're not going to comply, then it seems to me it would be helpful for the local health officer to say, okay, we'll double check this with the state. Because you are contesting it, I'm taking your objection back to the state and have them reaffirm whether or not I, the local health officer, am doing the right thing. And in 99 out of 100 cases, or maybe 999 out of 1,000, the state's going to affirm that, but then the local person who has the objection has the assurance that there's more behind this if they don't believe the local health officer. And then if they still don't like it, they can do this appeal to this board, but that might take, a week or two.
I guess one thought that I had while you were bringing this up, George, is that appealing to this board, I don't know about the rest of you, but I don't know that I have any expertise to make a decision on whether to uphold someone's appeal or deny it. And I don't know how we go about, if that should happen, how we would go about making that judgment. Laura?
I would think just like anything else, we would talk to the public health officer, ask the process that came across for it, what was the evidence for it, listen to the other person, and then weigh it. I mean, I don't see Liz just pulling, as an example, Liz pulling something out of there and just, I think we're searching for something that George himself has just said, odds are it won't happen.
Yeah.
And if it does, then we'll deal with it because we can always bring in corporate counsel. So honestly, I'm in favor of this, and I don't know what the tweaks are. I would imagine it's just how the fines and penalties and such come along with it. But I would make the motion to pass, I'm scrolling up, hold on a sec. To pass the communicable disease ordinance, to pass it on to the county board.
George?
I don't understand this to be written up in the form of an ordinance at this point in time. Is this intended to represent the final ordinance that would come before the county board?
This would be the ordinance, yes, with the exception of if there would be any revisions identified by corp counsel.
Dan?
Sorry, you need to have a second first. All of the debates
Yeah,
out
right.
of order.
This is Laura Cruz. I second the motion.
Okay, now we've got a motion and a second. I guess I'm wondering how, if corp counsel makes some tweaks, as Liz had mentioned, how we address that. I mean, is the motion to include any tweaks that corp counsel might make between now and the time it goes to the county board?
If it just has, if the tweaks just have to do with the fines and penalties in there, yes. If there's anything bigger, then I still think we could. Matt's got his hand up. I think we could take that up at county board, but in the general, this is a pretty solid process here and explained very well.
Matt, do you have your hand up?
I do. I guess I guess I'm kind of looking at what George has said and agree that, there's something that needs to be figured out there and we're not there yet. I can understand a need for it, but I can also think of at least one example, and I forget where it was. I think it was out on the East Coast where a person came back and was suspected of being exposed to Ebola and was ordered to stay within her house and just blatantly disregarded it. And, so I guess some of the comments that have been made, I think this should be looked at deeper and then should come back to it at another meeting. So I'd ask that it be tabled until some of those questions can be addressed.
George?
I
think.
Okay, first of all, is a motion to table privileged?
I think so. I think we have to vote on that. And I don't think it needs a second either, does it?
It does.
It does.
Yeah,
Okay.
it does.
Okay. So Matt has made a motion to table. If there's no, George?
If you need a second, I'll provide the second.
Okay. All right, there's a motion and a second to table this until the next meeting. All those in favor signify by saying aye.
Can we have a roll call?
Okay, that'd be better.
Did you want me to do that?
Yeah, do a roll call. Yep.
Another one? Okay,
Yeah. This
All
is
right.
this is to table this agenda item.
sure. Clarence Campbell,
Yes.
George Busse,
Yes.
Matt McKenzie,
Yes.
Dr. Keller,
Yes.
Dr. Horning, Dr. Horning, Laura Cruz,
Yes.
Joy Henrichsen,
Yes.
Laura Negro,
Go.
Richard Huber.
Yes.
That's it.
Okay, motion passes to table till the next meeting. Maybe we can get some of these questions cleared up by then. Okay, we'll move on to CCS recertification. Terry and Val.
Okay, I will start out with some really good news that we all need from time to time. And I am happy to tell you that we had a recertification visit for our CCS program in January. And for any of you who have worked with the state or been surveyed by the state, the sweetest words you can hear are, "You have no deficiencies." So we heard those words and more. So I just want to share with you that our surveyor used some, she was just so impressed with the organization, how excellent our processes were, how precise everything was. And that was for documentation and supervision of the CCS program. She was just glowing with her remarks, which is refreshing. And just kudos to them and the leadership of Val and Terry in their supervision of that program, and really the organization. They had everything laid out, made it simple for the surveyor to find what she needed. She gave us some examples of some nightmare situations she'd been with, and this was very organized for her. It went quickly because of that, and they were available to answer any questions. And so just congratulations to them. And Val, I will let speak a little bit also about her staff in the process.
Yeah, so she spent a whole day, and what she does is she goes back and looks at everything for the last 2 years. And so what this represents isn't that just the last couple months right before she came, we did something right. This represents 2 years of consistent work by the CCS team. So I really want to, I'm very proud of the team that we have assembled, and we've got a great team. And again, like Terry said, the no deficiencies, but also the longest recertification you can get is 2 years. And we got 2 years.
Very good, very good. Anything else on the recertification? And we'll move on to Child Protective Services data. Jerry.
Good evening, everybody. First thing, before I get into that, I just want to say Scott Griffiths is terrible at one thing, and that is tooting his own horn. Scott has been absolutely amazing in this community, and he has brought, I want to say it's like $2.2 million to this community in grant funding in the last couple of years. And he has turned that into an absolutely stunning program over at Spark that is the envy of human services agencies all over the state that I have spoken to. So I cannot say enough as far as Scott is concerned, and what an amazing person he is, and what an incredible job that he does. Somebody brought up the grant funding. I don't remember who it was. when Amber was speaking. And I had a question for Amber, but now she left. Carrie, you know, does that number for the total grants that were budgeted and what was actual, does that include the $575,000 of this last grant that Scott was awarded?
No, it doesn't.
It doesn't. So, I mean, it's just this last grant, $575,000 brought into this community to be spent here in this community. I can't praise Scott enough. So I just wanted to throw that out there first and foremost. Second, on a pretty sad note, we have in the children's unit been fully staffed for quite a while now, and that will come to an end as of Friday. Sue Miller, our intake access worker, and her husband are moving to Florida, bought a condo on the water. And we're joking around with her this morning that there will need to be a Wisconsin wing in the condo, so we all have a place to go stay when we're wandering around Florida. But thanks to Dan for giving us quick approval to get that ad out and get that position filled as soon as we possibly can, because boy, do we need it. And I'll get to that here in just a second. So I don't know, can I share my screen? Does anybody? I think I can. Can everybody see that chart right there?
Yes.
Okay. So this is I got a bunch of graphs for you. I know it's not as funny and comical as I usually am, but so we're doing graphs tonight. This graph represents the orange are the Child Protective Services intakes in 2022. You can see the actual total number of calls were up. I believe that's, I don't remember off the top of my head. It's somewhere around, I think it was around 30% up from the previous year. You will note that we had more screened in reports last year at 108 versus 93 for this year. This number of 108 actually, my personal screening percentage in terms of screen in versus screen out was a full 10% above the state average. So I think that number is a little representative of me being a new supervisor at the time. And then also it has to do with a lot of the different circumstances that came in where it's got to be screened in, it's got to be screened in. So, and then over on the far side here, you have screened out reports between 2022 and 2021. Didn't switch. Okay, so these are the different types of reports that we received through our intake access. So you can see 107 physical abuse, the sexual abuse, neglect, emotional, and then this number here, this 212 services requests. These are calls that aren't necessarily Child Protective Services, but folks calling in and saying, you know, I'm kind of worried about this family down the street that they might need, you know, some help with this or help with that. And these are the reports that we take regarding those types of situations. So that brought our total of intake access calls, which doesn't include just plain old information referral calls and things like that, but our total number of calls last year to 449. So you can see our intake access workers is a pretty busy customer. This chart I think is extremely interesting. So here we are in Ashland County at 316 CPS calls last year. And take note here that we in Ashland County had more Child Protective Services calls last year than Bayfield County and Sawyer County combined. So that will show you graphically just how busy my folks are and the amount of work that they're churning out here. I picked these counties in particular, obviously they're close by, but they all have they're all very close to the same population. Sawyer County is actually a little more populated than Ashland County. Ashland County and Bayfield are extremely close, and Price County is the lowest of the four. And I had mentioned screening decisions by county. Here again is our state average of 30.43. We came in at 29.43, and then Sawyer County at 29.37. Not sure what's going on here in Price County, but that's up to them. So as you can see, we're right in line with the state average in terms of screening, which is a really good sign for us, because I think that really says something about how well my workers are doing in terms of following along with the CPS access standards, which really drives what goes into those CPS reports when they're documented in our state system. And my workers, when they take a report, they're also making a recommendation to me based on their interpretation of the CPS standards, whether or not a case should be screened in or screened out. And I think that goes to show that we're right in there with everybody else in the state, and right on the money. I think here now. So I also took the liberty to throw some youth justice statistics in here too. These are youth justice numbers for last year and 2021. You can see again a substantial jump in business in our office. I just figured this one out. This was like 55% increase in the number of juvenile court referrals that we received in 2022 from 2021. These numbers here are the actual crimes referred. So we may get a juvenile court referral on a youngster that has 1, 2, 3, 5 crimes on that one referral. So that's where you get this bigger number of 161, is that there was multiple crimes on a particular referral. And you can see that we have again, a significant uptick in the number of crimes that are going on in our area here. And then this is the number of individuals referred. So what this is telling us is that you have multiple individuals with multiple juvenile court referrals. So we don't have a ton of kids, we don't have 161 kids out there doing individual crimes. For the most part, a lot of these criminal acts are done by the same kids over multiple times. And I think that was all I had for charts. So I guess the end all be all there is that we continue to get busier and busier and busier. Our situation seem to be getting more and more complex as time goes by. We are having more and more difficulty finding placements for youth that are high acuity youth. Part of that issue is that we've lost a huge number of placement providers throughout the state, especially residential care centers and group homes. We've probably got half the residential care centers that we had 4 years ago, which means that they are getting really picky about the kids that they're taking because they can. They're always going to take the easiest kids first, and that's making it extremely difficult for us to find placements in the state. As you guys are aware, we have one placement out of state right now that is of significant cost, which I'm happy to report will be changing venue to another county, I believe next month. So that's going to help us considerably. That's about all I can think of for now. Anybody have any questions?
If I can just add one thing, because Jerry kind of cut himself down a little bit when he was a new supervisor, but he's been with us for 30 years and he knows what he's doing, and he knew what he was doing in 2020 when the pandemic hit. What happened across the state in 2020 was schools were no longer in session. A lot of our mandated reporters were not seeing the children. So when we finally got reports, they were substantial and they needed to be screened in. So I just want to give Jerry a thumbs up. It had nothing to do with his maybe being a new supervisor. It was the pandemic related lack of mandated reporting.
I didn't even think of that one. Thanks, Tara.
This is Matt McKenzie. Just a quick question. And Jerry, I don't know if you know it or not, but the Prentice House, are they still fully functional, or it would appear one of their homes is no longer being used?
That is correct. Prentice House 3, due to staffing shortages, had to be closed down, which is the same story we're hearing all over the state for group homes and child caring institutions. they can't get the staff to keep the homes fully staffed.
Okay, thank you.
Yep. I have approached Mike Turgeon about potentially using that building for some other things like child visitations and potentially a child advocacy center, and it kind of perks his attention, but I don't know if we'll get there or not.
Any other questions for Jerry?
Well-
Seeing none, we'll move on to staffing updates. Terry. I think you're muted.
Okay. So we had a couple substantial things happen where our Assistant Corporation Counsel, who was Griff Nordling, had been with us since at least 1999. And he retired at the end of 2022. And through the RFP process, we hired Alex Moorbacher to replace him as the new Assistant Corporation Counsel. And that is working out really well. So far, so good. And we're happy to have really good expertise in that area again. Jerry had mentioned Susan Miller has tendered her resignation and will be moving to Florida, and we are all a little bit jealous. Heidi Hagen, who works in economic support, has also tendered her resignation. She will be working for the Washburn School District. We are still recruiting to fill the coordinated services team position in the adult unit. That is referred to as CST. So if you see that, we're continuing to advertise. We're trying to boost it and put it in some different areas. And we're very hopeful that we will get that position filled. It's a really good position. It's working with youth who may have some different needs in different areas, so that this person coordinates it so that we aren't all in silos. And so I think it's a really good position. So I'm hoping somebody will want that. And then just an update, we did, as you are aware, we hired 3 new economic support workers in November. And with those positions, there's an intense and an immense amount of training, and they're getting through that and doing really well. And they will be working with our residents throughout the consortium with the unwinding process as food share and Medicaid COVID policies are coming to an end. They will be essential in helping with the amount of calls and helping our clients as we get through this process. So just to remind you, when COVID started, and Amy can speak better to this, but when COVID started, policies changed in regards to the amount of food share our residents could get. So instead of getting a minimum amount or a certain amount based on income, everybody got the highest amount that they could get for that family unit size. And that is all being reversed. Unfortunately, many people have kind of accepted that as part of their budget process. And, you know, anecdotally, we've heard people have made purchases and gotten loans for different items. And it's going to be a hardship for some people. Also with that, the continuous Medicaid eligibility is going away, and that will be hard for some members as well. Anything you wanted to add on that, Amy?
Yeah, with the Medicaid end of things, there is, Terry's correct, there's going to be an unwinding with that. Right now, we have been maintaining Medicaid eligibility despite income or assets, so conditions that might normally make a person ineligible. If they were eligible from April 2020 forward, we were able to maintain that Medicaid eligibility for them throughout the public health emergency. The state DHS really hasn't given us full direction on how exactly and when exactly we're starting with the unwinding, but we are anxiously anticipating that news coming shortly. For the emergency food share benefits, the most immediate impact we're going to see within our community is going to be the end of the additional food share benefits, the emergency food share benefits. And that is this month of February is actually our last month for those benefits. So we are anticipating probably high call volume, perhaps member confusion, probably starting in March. Usually those benefits are issued at the end of March. And we and the state have done our best to communicate all of that out to all of the members. We were able to utilize some community posting boards to, pass out some of that information to our specific community within the county. So hopefully everyone has gotten the message, but that is going to be a pretty big impact for a lot of our members.
Any more questions on that?
This is Rich Huber. I have one. Is that also the SNAP program or is that the same thing?
It is the same thing. Food share is what Wisconsin calls our version of the SNAP program. So yes, when you hear SNAP and food share, they're pretty synonymous.
Okay, thanks.
Amy, this is Laura Cruz. I'm wondering, is there an impact for government, like commodities, et cetera, that may have go to like nonprofit food pantries? Have you heard anything about that?
I have not. At this time, I'm not aware of any impacts with those particular programs, or if food pantries are going to be impacted. It just sounds like right now the dollar amount as far as what is actually issued for food share benefits is going to be the big impact, just because that's where the benefit was increased to compensate for the pandemic and financial issues during the pandemic.
Could you just please keep your ears open on that one, because I don't know if it's like conspiracy theory things that food pantries aren't going to be getting the same level of support, or that support is being taken away. And it'd just be helpful as a board member to be able to say, that's not really true, or yeah, and that would be very problematic for our communities.
I can definitely take a look. I know that one of our processes right now, and part of the direction that's actually been handed down from the state, as well as within the Northern Consortium, of which, Ashland, Bayfield, Iron, a lot of our local counties are part of, is to help direct people to like 211, which is you can call or you can go online. They have a list of places where people can get further assistance. We are also making note and training our workers to discuss other programs that might help alleviate some of the financial burden, like our heating and energy assistance program with WEEP. We've discussed WIC with individuals, which also helps with some food programs and formula and things like that. And then with our seniors and our disabled and blind population, we are also, and the state is heavily advertising on this end too, the benefit of using their medical expenses to try to help increase their food share benefits. So we're hoping all of that is getting out to our members, and we're making an active attempt while we have them on the phone, especially because that's our best outreach time when we have their ear, to let them know about those medical expenses and, what might help increase their food share, because we are going to be looking at people who are used to getting $281 a month, and that benefit is going to go right down to $23 next month.
Laura.
Amy, if there's some information you want to get out to the seniors, you can go ahead and email me that at the aging unit. And I've been, since I got the email from DHS, I have been doing talks during lunch about what is happening, at answering questions, referring them to the ADR, see if they had more questions. So they've been very aware. And then there are some people who already had some of their benefits already. It must have been where their renewal was. But I'm seeing more seniors needing to double up on meals. So if there is somebody that needs a little more help, I'm waiting. So just send them on over.
Thank you. It's good to know that there's an additional resource out there. Thank you.
Any other questions or comments for Amy or Terry? Then we'll move on to written materials. Anyone have any questions about those that were included in the packet? Or any of the supervisors want to point out anything that's in those? Seeing none, we'll board member updates and possible agenda items for the future. George. Go ahead, George. Muted.
There we go. Okay. I just wanted to say that I really fully support the intention and the direction of approving this communicable disease ordinance. I'm just like us to see us work out any wrinkles before we bring it to the full Ashland County Board. That's really my intention. I don't have anything else to contribute.
Okay. Yeah, I was thinking that same thing, you know. I mean, we hope that Corp Council might be just tweaking some of the penalties and things along that nature, but what if something changes, we approve it, and then something changes, it'll have to come back to us for approval again. So I think we just need to make it the way we want it before we send it to the full county board. Any other comments from board members?
Clarence, Matt McKenzie.
Yep, go ahead, Matt.
I just want to let the staff know, and I'm sure you feel the same way, that we all greatly appreciate what they do for us. We know that you're busy and that you've got a lot of different moving parts, but we do appreciate what you're doing, and you know, that leads into kind of what you two were just saying. It's not that we're against something, but we want to see it more bulletproof so that you don't have to spend more staff time, you know, afterwards chasing our tail. So I do appreciate all that you do, and I'm sure that my fellow board members agree with that. Thank you.
Thanks, Matt. Yep, good comment. Anything else anyone would like to bring up? And we have any other business? And I don't have my schedule in front of me. What's our next meeting date?
I believe it's April.
Yeah.
Is it?
April 19th.
Or 19th.
April 19th, yeah.
Yep.
So then we are on item number 16, adjournment.
I would so move.
Go ahead.
Laura Cruz, second.
Dr. Keller normally makes the motion and Laura Cruz seconded. All in favor of adjourning?
Aye.
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 Anyone opposed? Motion carries. Thanks, everyone.
Thank
Appreciate
you,
your time.
everyone.
Thanks, everybody.
Thank you.
And thank you, Clarence. Good job.